Hi everyone, welcome to this session. Today in this session, we are exploring on we can bridge the gap between classroom learning and community engagement. As an educator, our goal is always to equip our students with skills they need to tackle real world challenges, especially in public health. So this session will talk about how we can integrate practical problem solving into our curriculum. We will delve into different strategies that not only enhance our teaching methods, but also prepare students for complexities of the real world, especially in public health work, which I do. My name is Palak Gupta, and I am assistant professor in the Department of Nutrition, Dietetics, and Food Sciences, and I am extension specialist for Hunger Solutions. So, in the next slide, we are going to discuss specific objectives we want to achieve in this session. So, by end of the session, you will be equipped to identify strategies for weaving real world tasks into your course design. And then we'll explore the application of backward design, in which we will create an interdisciplinary project-based learning assignments that are both engaging and impactful and useful for our students and our future workforce. So let's talk about why do we need real world learning. So in today's world, students encounter intricate societal challenges, and employers are always in search of creativity, collaboration, and critical thinking skills. Sometimes conventional lectures frequently lack experiential depth, and that's why real world challenges and real world learning is so important. This is a quote from Benjamin Franklin, which I think really resonate with the work and the course, the way I teach. Tell me and I forget, teach me and I remember, and if you involve me, I will learn. So we are just going to deep dive a little further into this. So let's explore where these real world learning takes place. So we'll look at our graduate level course, which I teach, program planning and evaluation in public health. So this course emphasizes on applied learning, focusing on community issues and developing public health program on it, along with learning on ways to how to evaluate it. So consider like our students, they come from diverse professions for an MPH. So this course is for Masters of Public Health. And our students can be dietitian, they can be already working professionals and the policymakers or veterinary health practitioners. So our public health course caters to nutrition students as well as veterinary students. So we have diverse background students which come to this course and with varied background and enriched learning environment. So by integrating real world tasks, this course prepares students not just with knowledge, but also with skills to make a tangible difference in their communities. So we are just going to think about how we can rethink course design and further enhance these outcomes. So we will be focusing, and we are focusing on authentic, real world, problem based learning. This approach not only makes learning more engaging, but also ensures that our students gain practical skills relevant to their field. So by anchoring our courses in backward design, we begin with the desired health outcome and our desired and design our curriculum or our program that is achieved or that is designed to achieve those health outcomes. So we have a health outcome in mind that our population, our public health community should be healthy, and it could be any health outcome. And now we rethink our design on like what programs we can develop to achieve those outcomes. So this method ensures that every component of the course is purposeful, very intentional, and is aligned with real world needs. The assignments which are created in this course are very carefully crafted to align with public health core competencies. So these alignment guarantee that our students they are not just learning a theory, but are also preparing to apply their skills in real world scenarios. I feel like it's very powerful when you think about it, like how you can approach and transform your classroom learning into stepping stone for like real world successes. So let's talk about why real world projects are invaluable in this course. So, first, they drive students' engagement and ownership. So, when students work with real issues which are actually occurring in our community, they kind of are more invested in the learning process. These projects also promote system and interdisciplinary thinking. Students learn the bigger picture on like how different disciplines can come together and solve complex problem. So a lot of my work, we'll talk in the next slide, it is teamwork. So students come from different professions and they work together. They have different thinkings, they have different learning experiences already, and they come together and look at the bigger picture of a public health problem and they try to solve it from their own learnings and experiences. Real world projects help build transferable skills, such as we in this course we talk about program design, how to design a program, how to collect data, and how to do evaluations. So these skills are very crucial that students will carry into their public health professional careers, making them more adaptable and effective. So as I mentioned, that this course is in this course we work very closely as a teamwork, and many of the projects are teamwork based projects. So we have just explored and discussed what are the advantages of project based learning. I just want to touch a little bit on like why teamwork is important and why it is important in this course. So in many professional environment, uh, even like in our professional environment, collaboration among various roles and disciplines is so crucial. It just not enriches learning by introducing our students to variety of perspective, but it also hones their critical thinking and problem solving skills. So teamwork is like deeply important and it develops essential skills such as how to communicate with each other, how to resolve a conflict if it arises, how to be a leader within their group. It also cultivates accountability. And I feel like importantly, it collaborative efforts foster equity by promoting shared responsibility and equal participation. So teamwork in course model can look like this in my class. There are like many collaborative assignments, and in the next slide, I'm going to talk about assignment little by little. But we have group development of we have group to develop data collection tools together to um, data collection tools which they implement in the community. They do community needs assessment jointly. They co create some logic models and evaluation plans. We have some real time feedback where peer and instructors provide feedback and encourages ongoing improvement. And then the digital portfolio which they create in the end, it highlights both the individual contributions as well as the team contributions and team results. I love this quote on the slide that teamwork transform learning from passive absorption to active applied engagement. I feel like when students collaborate, they transition merely from merely absorbing information to actively applying it, making the learning experience more dynamic and meaningful. And a lot of evaluations which I've received from my course, people have appreciated like the teamwork, especially in this course. And I'll share that later on in the slides. So this slideshow shows step-by-step process our students follow to move from identifying a real public health problem to designing a practical evidence public health program. So we start by having students select a specific county or community they focus on. So every semester I provide 4 or 5 counties in which, as a discussion, where students are required to pick one of the counties either they live in or they work on or it's just interest to them. So from there, I create a team of the students who will be working on the same county together. And from there, I ask them to research on top public health priorities of that area. Identifying top public health priorities is an independent assignment because I want them to independently first review what they think top health priorities are. So they are required to look at the what resources, what programs already exist in that community, and where are the clear gaps. So I asked them to review secondary data and some reports from their community to identify what works in their community, but where are the gaps which they are already lacking. And then once they have developed this individual assignment, I ask them to come together and identify, take all those public health problems they have identified, and then create a qualitative tool such as questionnaires, survey, or it's an open-ended survey or a focus group discussion where they could gather measurable data on these unmet needs. So I asked them to identify a relevant stakeholder in their community. It could be an expert in their community, someone who's working at health department or an extension field, or it could be a person working in a hospital, and I asked them to conduct qualitative interviews on them. This gives them richer insight into the local context, cultural factors, hidden barriers that are many times our reports don't capture. And then they analyze that qualitative data to identify what are the common themes they have identified and what are the key findings. They combine that evidence with their with the secondary data they already researched on, and they define a program which focus on the identified issues, and they write the goals of the program, objectives of the program, and define name of the program. Once they do that, we make sure that the objectives they create are SMART objectives, that they are specific, measurable, achievable, relevant, and time bound. So they are actually realistic and actionable. Once they have developed those objectives, I ask them to create a logic model, which actually is a detailed action plan that outlines how the program will be delivered. So they start thinking about how they are going to achieve those objectives, what resources they would require to achieve the objectives, what activities they have to take to achieve those objectives, and then a bigger goal. And then finally, once they have created those action plan, I ask them to create an evaluation plan on the program, on like how they are going to measure it is effective and it is making an intended impact. So this entire flow mirrors how real world practitioners design community health intervention. So by end of the program or the end of the semester, students not just have learned the concept, but they have practiced each stage of program planning with real data in real community with real outcomes in mind. So in this slide, I've kind of highlighted the final deliverable for students in this course. It's a comprehensive digital portfolio which brings together all major pieces they have of applied program planning work. So this is our final assignment for the course, which is a final portfolio. I asked them to pull information from each program, each assignment they have built on. So I have to say, like each assignment built on the other. So completing the first assignment is very important for a meaningful second assignment, and so on. And the last digital portfolio is culmination of all those assignments together. So the portfolio starts with clear need and problem statement, with student developed as an initial assignment using real needs assessment data they collected and then analyzed themselves. This ensures that their proposed program is rooted in evidence and local context. Next, they have to move into program development, where they clearly have defined their program objectives, outlined overall program design, built detailed logic model and the action plan. And this connects to what they learn directly to how to plan and create a meaningful impact. Finally, they create a comprehensive evaluation plan which explains how they will measure program successes. These include selecting appropriate types of evaluation methods, defining which theory they are using, describing the methods they'll use to collect data, and drafting some sample questionnaires or survey within their population. So once this is complete, this final portfolio is, I feel like it's more than an academic exercise. It's a professional product students can, in the end, share with future employers or community partners to demonstrate their applied skills in real world program design, implementation, and evaluation. I also encourage my students to present this work into conferences, whether it is university conference or a state conference, to share the program idea they have developed with other public health professionals. They may have thought of it, or they may not have thought of it, or this would be their opportunity to improve their final portfolio as well. I wanted to take a minute and talk about the rubric design for our authentic learning. So there are key assessments which I ask them to, on which I evaluate my students. So let's focus on critical thinking. So we are looking at the depth of analysis, how well the evidence is, how well they are able to identify the secondary data, how well evidence and reasonings are used, and their ability to synthesize and apply knowledge. The next is in my rubric, I focus a lot on collaboration because collaboration is key to this course. So this involves not only contribution to group tasks, but also effective communication and teamwork. How responsive students are to the peer feedback also plays here role too. And then I asked them to evaluate their peers. And see just to see like if everyone had opportunity to equally contribute. Then we have real world application. So this dimension assesses the relevance and feasibility of solutions and the integration of community based insights, what they learn from qualitative data, and their alignment to what they identified in secondary data with authentic program planning processes. It's all about making learning applicable beyond the classroom. And finally, I have student reflection components in my rubric. These include growth, learning, and feedback. Students should be able to self assess their skill development over time and gain insights from challenges and successes, and also be responsive to peer and instructors' input. Um, This is a quote which I again found that a well designed rubric doesn't just measure performance, it guides our learning and reflection. So we should use our rubric to just enhance our educational practices. So I wanted to take a moment and share some of the student reflection on this course. So one of the students shares that I've learned a lot about program planning and how to assess needs in a public health setting. So this highlights a key takeaway from the course that they have started understanding the foundational aspects of public health program planning, and they're going to utilize it in their careers. Another student mentions that I have really enjoyed the group projects. Being able to collaborate and learn from one another has been very helpful. And I feel collaboration is so essential for public health programs and public health in general. And it's great to see how has enriched their experiences. A lot of time we talk about like students not liking teamwork, but in this course I feel like teamwork is the key, and knowing that students enjoy learning from each other, that makes that's the point of the course this course. Another reflection is like a student mentioned that it will help me in future when I have to assess health issues and plan interventions. And this shows the practical application of the course content in real world scenarios. And lastly, this class is directly applicable to my future goals in public health. And I feel like it's so rewarding to see how the course aligns with the students' aspirations and preparing them for their careers. Each of these reflections shows importance of integrating knowledge into practical skills and collaboration, equipping our students for their future roles in public health. So these are some of the valuable lessons I learned from this course, and I hope you learn from this course. Um, First, support is crucial. By having assignments in scaffolding form, it is like scaffolding complex projects with clear milestones. We are able to help students manage their workload and help them stay focused on their goals. This structured approach only provides us not only provides a safety net, it also fosters confidence as they progress through each assignment. Second, while students initially they resisted ambiguity, they actually grow through it. So in the start of the course, this course seems a little ambiguous for our students. And as I was developing this course, the students found this course very ambiguous. But through their evaluation, improved the course. But over time, this course encouraged them to embrace certain uncertainties that helps cultivate critical thinking and adaptability and the skills that are essential in real world scenarios. Um, what has helped me is I keeping myself available for students. I have a policy that I reply to students within 24 hours if they email me, and I try to meet them within 48 hours if they want to meet me. So if students have any questions or any concerns that need to be addressed, we can address that. Initially, sometimes some groups work, some don't work. So that by keeping myself available and providing them that support has really helped this course to grow. And I also, over time, provided some examples of the assignments to the students, which previous year students did, just to help them through the ambiguity, to help them know that you can work through it and it would be helpful and it would be a great product in the end. Finally, this is what I learned is benefit from balance of creativity and structure. So allowing room for innovation within defined framework not only sparks creativity, but also ensures that learning objectives are met. And keeping my rubrics very structured, it helps students know what I'm expecting and how to work through the assignments, but they have creativity to work through it as they would like and their group would like. So in the last few slides, I want to mention that as we that you can apply these concepts into your own classroom. And I just want to touch a little bit of strategies, how you can do that. And this is, I'm just thinking about it on like how to do it. Um, so start with community anchored questions. So this ensures that the learning is rooted in real world context that matters to your students. Use backward design to scaffold projects. I thought that was very important, helpful for me as I was developing this course. This approach helps me creating a clear roadmap for students, making a big complex project more manageable. If in the start I ask them to create a program for their for a community, they will know where to start. But thinking about the health outcome or outcome in mind and then working backward with like step by step project, it made a complex project more manageable for them. Blending individual and team-based deliverable um, helped this course, and it encourages both personal accountability and collaboration. It's a balance that prepares students for future professional environments. So when I started this course, it had a lot more team projects. And I realized sometimes because students in our program are working professionals, they are all from all across the United States and sometimes even further. Um, it's sometimes hard for them to juggle with their work and their deadlines, but providing ample opportunities to do independent assignment as well as group assignment has really helped. I also provide them a catch-up week in between the course where a lot of times students struggle because the program is deeply rooted into practical community-based learning that sometimes they may not find professional at times to interview or do data collection on, or they may not have had time to rework on the assignment based on my feedback. So that catch up week really helped them to catch up on the assignments in case they are struggling. And if they are not, it gives them opportunity to hone into their existing work and just improve it. The next thing I think which would be really crucial is to provide iterative feedback throughout the project. This continuous feedback cycle helps students to adjust and improve, keeping them engaged and motivated. And as I mentioned, that this course assignment builds on each other. So if one assignment is not submitted on time or it is not up to the level where it should be, the next assignment would be affected. So having that feedback, constant feedback is really important. And being available for students has really helped me see my students succeed. Finally, employing rubrics that value both processes and the product has been really helpful. This recognizes student efforts and creativity as well as final outcomes, fostering a more comprehensive learning experience. So these methods are not only enhance learning, but also prepare students for real world challenges. So I was thinking when I was making this abstract and this presentation that this model work in other field? I feel it absolutely can work, and that's what make it so powerful and flexible. The core idea is that real world problem based learning, and it translates, I feel like, beautifully across the multiple disciplines. I don't know about much disciplines, but I was researching and I found out, like, for example, in humanities, students could work on community oral history projects or they can create local exhibits that preserve cultural heritage. In sciences, which I'm more comfortable talking about, they might take lab research and apply to local environmental issues or public health screenings. In education, students could develop pilot lessons for schools. I know in extension, a lot of time we do develop and test curriculums in schools. And if I know students are already working on a public health curriculum, I would love to look at it and work from it, like build it from the base. So that is really a great example in educational program. Business students can partner with local entrepreneurs to create business plans or test new market ideas. And of course, health professional students can assess community needs and develop patient education material. A core component is that what ties together is scaffolded assignments, real community partnerships, and finally, a deliverables that student can take it forward. It's like a portfolio, as I mentioned, that shows employer what they have built is real, applicable skills. No matter what the field is, this approach sparks curiosity, creativity, and confidence. Exactly the soft skills and the hard skills, what we want our graduate students to take into workforce. So I wanted to take a minute and in this last slide to bring everything together and talk about empowering students beyond the classroom. Real world projects do more than just teach facts. They deepen engagement and promote equity. This approach helps students become true problem solvers rather than mere test takers. We have an opportunity to rethink how learning connect to our communities, and by integrating these real world projects we bridge gap between academic components and practical application. And through my extension work, I'm actually able to do a lot of it because I understand the practical application as well as academic concepts of it. So let's continue to explore how we can make education more meaningful and relevant to our students. Thank you. This is my contact information. If you want to learn more about the program, if you want to discuss any ideas on how to build your program into a more real world, how to root your curriculum into real world problem solving, I'm happy to chat about that. All right. Thank you. Bye bye.